The presentation of my talk will be on probiotics in infant formula. And as was said in the introductory words, breastfeeding is of course the best way how to feed all infants, but not every infant can be breastfed, and therefore we have infant formula. And I think it's the right for every non-breastfed infant to get as optimal nutrition as possible. So why is the gut in breastfed infants predominantly colonized with bifidobacteria? Well, it's because human breast milk is a source of diverse active bacteria, including bifidobacteria and lactobacilli. And bacteria in the human breast milk, they colonize the gut of the breastfed infants. And human breast milk contains also nutritive factors supporting intestinal growth of these bifidobacteria, and so therefore you get a mainly predominant bifidobacteria gastrointestinal flora in breastfed infants, whereas that is not the case in infants fed standard infant formula, because standard infant formula does not contain these extra nutrients and does of course also not contain probiotics. And we know very well that mainly lactobacilli and bifidobacteria are health promoting organisms. So because they inhibit the growth of exogenous and or harmful bacteria, they help also in the development and the stimulation of immune functions, and they help also in the digestion and absorption of food ingredients, and finally also contribute to the synthesis of some vitamins. So just for clarification, what are probiotics? Probiotics are living microorganisms that when you ingest them in an amount that is large enough will have a health promoting effect on the host. And the goal of my presentation is to show you how the addition of probiotics to infant formula has a health promoting effect on the infant. And as I already said, in fact, it's not at all strange to think that way, because human milk also is not sterile, but human milk contains small amounts, but contains probiotic bacteria. So the presence of bacteria in human milk has been acknowledged since already more than 20 or 30 years, and some strains have now been isolated, and it's very clearly that canaliculi of the breast are colonized, that there are specific secretion of, again, small amount of probiotic bacteria in human milk. So it's not a strange idea to add microbes to the second choice infant feeding, formula feeding, because the first choice infant feeding, breastfeeding, also contains probiotics, also contains bacteria. Now, what tells the literature about the efficacy of adding probiotic bacteria to infant formula? And I will mainly focus on 3 different strains, namely Bifidobacteria infantis, which changed during the years of name. So when you read about Bifidobacterium lactis, Bifidum, BB12, or Bifidobacteria infantis, it's in fact all the same Bifidobacterium. Another important probiotics is Lactobacillus rhamnosus, GG, and Lactobacillus reuteri. So this is the very first study which was performed in pediatrics with probiotics, and it's not really in infant formula, but it's important because it's the very first study which was published in the Lancet now already 20 years ago. So it's certainly not new, but what was shown there is that by adding Streptococcus thermophilus and Bifidobacterium bifidum to children which were hospitalized for a long time because they were in nurseries, you could prevent the development of nosocomial diarrhea with 7% compared to 31% in the control group, which is of course highly significant. So this was 20 years ago already, for the very first time, that the benefit of the addition of probiotic bacteria to infant feeding was clearly demonstrated. Of course, many other studies have been performed later. And this is a summarizing table of several studies on probiotics for the prevention of acute diarrhea. And in red, you see those for Bifidobacterium lactis, and green, Lactobacillus chichi. And you see that there are a number of studies which show that addition of both Bifidobacterium lactis and Lactobacillus chichi decrease the incidence of acute diarrhea in prevention. So just giving them to the infants in a community decreases the incidence of acute infectious gastroenteritis. Another study also looking at acute diarrhea looked at treatment for acute diarrhea with Bifidobacterium lactis BB12, and it showed in fact that if you give an amount high enough, that in this study there was no difference in the duration of diarrhea, but that you had a decrease of rotavirus shedding in infants fed the formula with the high content of bifidobacteria. And that's of course very interesting in hospitals where infants are hospitalized because of rotavirus gastroenteritis. And by giving this kind of formula, you decrease the shedding of the rotavirus from one baby to another baby. This study looks at the effect of infant and follow-up formulas containing bifidobacteria and prebiotics on infection in healthy term infants. What it in fact shows you is that the addition of prebiotics to the probiotics is of no additional benefit, because there is no difference between the two groups. So probiotics itself are equally effective than probiotics with prebiotics for the prevention of upper respiratory disease, lower respiratory disease, gastrointestinal infections, or grouping them all together. And if there is any difference, the probiotic alone did slightly better. Looking at the growth of the children, you see also that for weight for age, BMI, head circumferences, length for age, there is no difference at all between the two groups. So the mean and standard deviation infection rates in the infants, which were followed for a duration of 1 year, shows in fact no statistical difference, and shows you that the probiotic alone is equally effective than the probiotic with additional prebiotics, and that the weight gain with the group with the probiotic alone was in fact slightly better than the weight gain of the group with the pro and the prebiotics mixed. So this certainly suggests you that symbiotics, pro and prebiotics, are not necessarily better than probiotics alone. I told you that that one of the important advantages of having a bifidobacteria predominant flora is having better immune response. And this shows you in a study with BB12 in infants that you have with the BB12 higher levels of secretory IgA, a better response to rotavirus vaccination, and a better response to polio vaccination. So this shows you that the addition of probiotics improves the immune response of the infant to vaccinations, and that there is also an increase of secretory IgA, which improves the defense possibilities of the infants against infectious, mainly infectious gastroenteritis. Of course, overviews have been performed here with Bifidobacterium lactis bb12 or Lactobacillus GG, showing on weight gain that in fact compared in infant formula with probiotics or standard infant formula, there is no difference. And this is from the same meta-analysis on BMI that finally there is no difference for bifidobacteria, and there is a trend that it is slightly better. So the results, the conclusion of this meta-analysis was that supplementation of infant formula with Bifidobacterium lactis results in a growth similar to what is found in infants fed unsupplemented formula. And this study looks at the same aspects, at the weight gain of infants, of pooled, randomized, controlled trials with Bifidobacterium. And it shows you overall that, in fact, you have a better growth. And what is very interesting is in that this meta-analysis, there was a group of infants which was HIV positive, and that the results on growth, better growth, were much better in the HIV positive group than in the HIV negative group. And at the same time, there were no adverse events. So septicemia with the probiotic did not occur in the group of infants which were HIV positive. So let's move to Lactobacillus GG. This is a randomized, double-blind, controlled trial with Lactobacillus rhamnosus GG, and looking at the absence in daycare centers, which was significantly different in the group. So again, suggesting better health outcome with the probiotic supplementation. Lactobacillus rhamnosus in nosocomial gastrointestinal infections, prevention, you see a very significant decrease with almost 50%. Looking at respiratory diarrheal episodes, you see also a very significant decrease, going from almost 8 episodes down to 2 episodes over the period of the study. This looked at respiratory infections, also showing you the preventive effect, going from 5.5 down to 2.1. Another study with Lactobacillus rhamnosus GG, this time not in infants, but in older children, 2 to 6 years old, shows you also a reduction in the occurrence of respiratory disease in the children attending the daycare center. So the advantage is not only in the very young infant, but also with follow-up formulas in older children, in children with age of 2 to 6 years, you still have additional benefit on the prevention of infectious diseases by adding probiotics to their feeding. Lactobacillus rhamnosus and atopic dermatitis, you heard this morning, for those brave who were there at the 7 o'clock symposium, that atopic dermatitis is a very important health problem, costing a lot of money. What it shows you is that you add Lactobacillus rhamnosus, you decrease the incidence and the severity of atopic dermatitis in a very clear way. And the supplementation was done during 6 months, but at the age of 7 years, you still have a clear beneficial effect. So you intervene between 6 months and 7 years later, you still have an additional benefit. So we were showing that giving probiotics during 6 months has a positive effect still at the age of 7 years for atopic dermatitis. And this recent review concluded that when 21 studies on 7,000 patients are reviewed, that specifically for Lactobacillus rhamnosus GG there was evidence that it is effective in long-term prevention of the development of atopic dermatitis. Again, this review says that prevention of eczema with probiotics seem to work until the age of 2 years, and extended effects until 4 years have been shown in higher risk for allergy cohorts, and that the most consistent effects are shown for Lactobacillus rhamnosus GG. Now let's move from Lactobacillus rhamnosus to Lactobacillus reuteri, and now in infants with chronic functional constipation. And this rather complicated slide shows you in fact that in the groups with Lactobacillus reuteri, after 2 weeks, 4 weeks and 8 weeks, in clear green, you have a much higher proportion of children with 5 to 7 bowel movements per week. In other words, what has been shown is that Lactobacillus reuteri is effective in the treatment of functional constipation in infants. Also, this Italian study suggests that Lactobacillus reuteri accelerates gastric emptying and therefore decreases the number of episodes of regurgitation per day. So probiotics not only have effect on infectious disease, have effect on immune-mediated disease, they also have functional effects treating problems with gastrointestinal motility, treating constipation, treating infant regurgitation. And then there are the studies on Lactobacillus reuteri and infantile colic, with this study from Savino showing that Lactobacillus reuteri significantly decreased crying time in colicky babies, and this already after 2 weeks of treatment. After 1 week it was just not significant. The study from Hania Sajewska confirms that the same kind of design in mainly breastfed babies with colic, double-blind trial with Lactobacillus reuteri, showing already efficacy from 1 week onwards. And then finally there was this very recent study from Australia showing in fact no difference between the probiotic and the placebo, but so there are 2 studies with Lactobacillus reuteri which show efficacy in the treatment of infantile colic, and there is 1 study showing no difference between the 2 groups. This brings me to a few slides on safety of probiotics, and already I've shown you data in HIV infants treated with formula with probiotic, where there were no incidents of increased sepsis or infectious disease. Study from Finland on Lactobacillus rhamnosus GG, which shows very clearly that the increased use of probiotics did not result in an increase of bacteremia. Again, a study from 6 years ago in HIV-infected children where probiotics were given, and so probiotics had an immunostimulatory properties and might be helpful in the treatment of HIV-infected children, decreasing diarrhea, and again, no incidence or no increased incidence of bacteremia or septicemia in these immunodeficient children. And finally, looking at the growth and the metabolism, this compares the urinary day lactic acid secretions in infants fed probiotic or a control formula, where there was no difference at all, showing that the probiotics are really well tolerated. So that resulted in the fact that Ezgan wrote a couple of years ago that Bifidobacterium lactis, alone or in combination, supports normal growth in healthy-term infants and is not associated with adverse outcomes. And the safety and clinical effects of one probiotic strain should not be extrapolated to other strains. An addition of probiotics, including Bifidobacterium lactis, according to the American Academy of Pediatrics, has not been demonstrated to be harmful to healthy infants, so it's very safe, and I try to show you all the beneficial effects. So to come to conclusion, again, of course, breastfeeding is the best way to feed all babies, but not all babies can be breastfed. And bacteria for babies, yes, why not? Because they are present in mother's milk, the first choice infant feeding. They seem to be very safe, and a lot of beneficial effects have also been shown. And this comes also from the Esben position paper from 3 years ago, that the addition of Bifidobacterium lactis has a 40% reduction risk of infectious gastroenteritis, just to show you that there is indeed some evidence that probiotics result in a better health outcome in term-born formula-fed infants. I would like to thank you for your attention. Terry McCarthy.